Good afternoon and welcome to the Medical Talk Show. Today we have with us Consultant Surgeon Dr. Vashista Kothapalli, and today we will be knowing about the surgical emergencies. Good afternoon, sir. So can you please tell me about what are the surgical emergencies briefly?
Good question. So normally the cases which come to casualty can be broadly classified into medical and surgical emergencies. Those cases which may require surgical intervention are termed as surgical emergencies.
So how do you broadly classify these surgical emergencies?
Yes. So coming to the classification, the most common surgical emergencies are those of road traffic accidents which have got polytraumas. Those come under first category of surgical emergencies because definitely they may require surgical intervention. The next are acute abdomen. These are also most common cases which present to the casualty. They may be further classified into solid organ perforation, solid organ or intestinal obstruction, or else appendicitis, which is the most common thing. The other thing is bleeding, which may be upper GI bleedings or lower GI bleedings.
Doctor, then what will be the approach or the treatment for these surgical emergencies?
Yeah, the treatment of each different case has got its own approach. Coming to road traffic accidents, first we need to get to the history of the accident or the trauma. Later we need to diagnose, and first we should go for a physical examination, which includes head examination, chest examination, abdominal examination, as well as periphery examination. During this course of examination itself, we can find out major diagnosis. Next, we need to go for a radiological diagnosis that may include X-rays, ultrasounds, or CT scans. And later, depending on the severity of the injury, we may require surgical intervention. Next, coming to acute abdomens. The most common acute abdomens which present in the emergency medical department are acute appendicitis. Based on the history, we need to post him for a surgery based on the severity and symptoms also. Next are perforations. Mostly they include duodenal perforations or intestinal perforations, large intestinal perforations, which need to be addressed surgically as soon as possible. Obstructions. These obstructions, they may be from already present hernias or else any carcinomas in the gastrointestinal systems. Later, coming to urinary retention, SPC, which means suprapubic catheterization, may be required to relieve urinary retention. Later, bleeding. Coming to bleeding, if it is an upper gastrointestinal bleeding, we need to manage it through endoscopy, and we need to get to the source of the bleeding and we need to control it. If it is a lower GI bleeding, we need to go for a physical examination that includes rectal examination. It may also include proctoscopy or else colonoscopy. Based on the source of bleeding and the nature of bleeding, we need to address it specifically.
So doctor, so these are the emergencies that we see in adults. So what about the children? How will we approach to them?
Yes, even in children, they also have the same emergencies, and the way of management is also similar in children. So let it be adults or children, always surgical emergencies need to be attended as soon as possible. For any sort of surgical emergency or medical emergency, do visit Medicover Hospital at Chandanagar.
Thank you for the information, doctor.
Thank you. Take care.